Hi everyone, and welcome to Chapter 6. We're looking at organizational structure and accountability. So what I'm going to do is just kind of talk you through the chapter, and as you're thinking about this chapter and as you're doing your reading, really think about what the focus of the nursing role actually entails within healthcare as a complex adaptive system. So we're looking at how instrumental nursing actually is in changing healthcare as defined in the Future of Nursing report. So think about your particular role in making a difference in how healthcare is delivered. And it's really important that you understand that you are actually an influencer as far as the evolving healthcare changes. So with that, it's important to understand the leader's role in the big picture within not only the organization but beyond the organization. So think about how the nurse's role is in a diverse healthcare system. So we're not just looking at your locus of control, because as we're looking at complex adaptive systems, everything interacts and everything actually impacts another. And think about the experience of health, and think about yourself. Think about how often do you actually spend time in a healthcare facility, in a doctor's office, in a pharmacy. Think about that amount of time in the context of your life. And in actuality, we spend probably 99% of our time outside of what is considered a healthcare facility, other than our work, of course. But the normal everyday person doesn't spend a whole lot of time within the healthcare system. So when they are in the system, we need to have those positive impacts on those that we care for. So really kind of keep that in mind, and think about how those guiding resources are telling us how we need to shift our practice, because the decisions that you make every day actually do impact how care is delivered. And sometimes we don't really think about our role in the big picture, and we just think about our particular facility, and we really don't think about sometimes how those factors outside our organization, such as those guiding policies that impact the care that we deliver, and that we need to be very knowledgeable about those factors, such as the triple aim, and how that impacts our decision making. So we need to be familiar with those things, otherwise we have this dichotomy as far as how we actually practice. And if we are empowered with the knowledge of those guiding documents, we actually have the power to make change based on those guidelines, when in actuality sometimes we may feel like victims as far as they're making us do these changes. And in order to make a positive experience for those that we serve, as far as the staff that we serve and the clientele or the patients that we serve, we need to have a good understanding, and we need to adapt based on what those guidelines may be, so that we can provide the best possible care within the constraints of the policies or the guidelines that are presented to us. So, with that being said, it's really important to take a deep dive into how decision making is made, and your chapter actually addresses decision making and decision making within systems thinking. So very often we are, as we've learned in our case studies, we don't have all the information up front to make a valuable decision, and sometimes it takes a deeper dive. to really understand. And some of those considerations needs to be the policies that actually are the guiding factors in our care delivery. So taking a step back, not only do we need to make decisions based on our particular locus of control, our particular unit, our facility, we also need to consider what's going on outside so that we can actually make sure that our area is in congruence with what the recommendations are, what the guidelines actually are outside. So kind of keep that in mind. Not only do we make decisions specific to our area of practice, but we also need to have some of those considerations outside of our locus of control as well. So I want to really take a strong dive into the decision-making process, and it's really important to know what decision you're making. So you need to be very clear on the decision. And whose decision is it? Is it your decision? Is it a shared decision? Is it a decision that needs to go to someone at a different level? How will the decision be made? And think about the timing of the decision-making process and how that fits within the context of the decision to be made. And also think about the how, the when, and to the whom the decision will be communicated. So those are all really critical factors to think about, and just consider how many things you need to think about as you're making your decision so that the decision is solid when you do make your decisions. And with that being said, there are many different types of decision making, and as a leader you're posed with opportunities. And again, we've seen some of the decision making within our case studies that we may or may not have agreed with. So kind of keep that in mind and think about the different types of decisions, and each kind may be appropriate in a given time frame. And again, that very complex adaptive leader will consider all those factors, and as there is a need to kind of come down to an answer. So you may be at some points be using autocratic decision making, probably not as often as some of the other decision making styles, but some of the other styles include inclusive, participative, democratic, consensus, delegated. So all of those are appropriate in different situations, and as a leader evolves, it's important to know those situations that are appropriate for the different types of decision. And again, the same holds true as you're looking at delegation and making sure that when you do practice delegation, that it's done well and that it's communicated well, because you want to make sure that the person that you're delegating to has a solid understanding of what the expectations are. And you need to, once you delegate, you need to give that responsibility to that person and not go behind and redo or second guess. So if you're actually giving the opportunity for delegation, make sure that it's the right person, and that this is an opportunity also when we're looking back at some things that we've discussed in the past, as far as it's an important tool in succession planning and mentoring to delegate. So you're allowing an opportunity for a person to actually grow and develop over time. So just kind of keep that in mind too as you're looking at the delegation process. So as we're moving on in your textbook to understanding healthcare financing, and that's a challenge sometimes, but again, in order to make valuable decisions or viable decisions, it's important to understand healthcare financing. And it's also one nuance I want to really drive home is it's important for those that you serve, the patients, as well as your staff, to understand that finance isn't the only focus, and that the true focus is care delivery. And that's a challenge in itself because it seems like we're always talking money, which is very important because we need to have a viable organization in order to deliver care, bottom line. But the thing is, in looking at this particular chapter, we also need to understand that as a leader, we need to, again, be very adaptive and understand how our decisions impact the care delivery system, and to help our area or our locus of control to evolve to be able to deliver care within the constraints of those policies, procedures, financial constraints, to continue to focus on the mission of the organization and beyond. So again, we need to rethink what we're doing. And sometimes we try to force what we've been doing for years and years and years in a system that's changed, and that's not really a productive system. So kind of keep that in mind, that with time we also need to evolve. We need to be innovative. We need to think about care delivery within the context of our scope of practice and use those like the AMA scope and standards of practice as a guidepost for us as we move forward. Ticking with strategic management, we need to really look at not only the here and now and where we practice, but also those factors outside. We're looking at on a macro level. We're looking beyond the facility, including policy, environmental, and funding and trends. So we need to look at what's occurring in healthcare, the big picture, so that we can adapt to the changes in healthcare. So we're looking at value-based purchasing, different patient care delivery models, affordable care organizations, or accountable care organizations, and we're also looking at many changes in how we're getting information, including our data management. So really focus on honestly, the power that you have as a nurse to make changes in healthcare delivery. And change management, we often think of change as very negative, when in actuality, change can evolve and be a very positive experience. And we need to take a deep dive how we actually respond to change and how that kind of inflects how we respond to change into those that we serve as well. So again, tie back to transformational leadership and looking at change management, and really focus on how change occurs. And it's not just we're going to do this change and we're going to do it now. Change needs to be very systematically planned, and many times the pre-change work is much more important than the actual change itself. So as leaders, I want you to really think about how important it is to create the culture that accepts change, and also create the culture for success, for changes to occur, or evolutions to occur. And many times we think of change as very negative. Sometimes we need to switch up the words that we use a little bit, and we may be evolving, we may be improving. Those may have a very positive spin on what some people perceive as very negative, being the word change. So again, take a deep dive into how you feel about change, and make sure that you're not presenting that to your staff as well. And really focus on evidence-based practice and looking at factors like high reliability organizations. So as you really examine this chapter, take a step back and think about how you think about healthcare, and think about how important it is to work not only where you are in your organization or facility, but think about facilities outside, other organizations, and bottom line, how you are going to function within a complex, adaptive environment.